Starting. All attendees are in listen-only mode.
Good morning and good afternoon, everybody. Thank you for attending our webinar, Great Plains Casinos and the Benefits of Reopening Smoke-Free. Today is August 27th, 2020. I did want to note that there will be no CEUs granted for this webinar. And again, my name is Joshua Hudson, and I'm the project director for the National Native Network, which is housed at the Intertribal Council of Michigan. And so for our first part of the presentation, I will be handing it over to Eugene Gallego, who is a program manager for the Great Plains Colorectal Cancer Screening Initiative.
Hello, everyone. Thank you, Josh. Thank you, everyone, for having me and allowing me to opening with the morning prayer. So I'll go ahead and begin. O tukashla ampetikile lila wopila tonka hichichiapi. Tukashla ampetikile washtekte naha vecha unkie dayake naha dagane shichakteshni tukashla. Duaki iu halal oanglakekte naha lila wuyukchawashte haginkte. Tukashla okola kiche daku ashtekte hityuhapo naha tukashla wichakchala na winukchala naha koshkalaka na wikoshkalaka lila wichozonikte naha makakile umbloni chapi tukashla unkpaga pishti chamshilapo tukashla hoye wayelo naha nami chinkuyel tukashla mitakuye oyase. Thank you.
Miigwech, Eugene.
Thank you.
Actually, I wanted to give a moment for Jennifer Williams to speak for just a few moments. And Jennifer, if you're speaking. Okay, perfect.
Thank you so much, Josh, and thank you, Eugene. I wanted to say thank you to all of our partners that will be presenting. I appreciate the knowledge and the resources that are being shared, and thank you all for joining us this morning. I think this is a great time since health is on everyone's mind. This is a great time to keep open this conversation about casinos and other entities going smoke-free, and we hope that we provide some tools and resources and conversation starters today. Thank you.
Thank you, Jennifer. So some housekeeping information. The way that the GoToWebinar platform works is it's not as interactive as other platforms like Zoom. So there is a question and comments capability under the questions and chat. So please feel free to enter your questions for the presenters. We did want to note that if you have a question for a specific speaker, please note who you're seeking an answer from. And so I will begin by discussing traditional tobacco. So many tribes across North America and into Central America use traditional tobacco. Tobacco is a traditional medicine for many people, but it's important to know that not every tribe uses tobacco as a medicine. And so with that, I would really like to highlight that there's a distinction between traditional tobacco and commercial tobacco. And traditional tobacco is grown with the intention for it to be used as a medicine. As it's an annual plant, you have to plant it every single year. So there's, intention that has to go there. Commercial tobacco is grown by companies and corporations to create cigarettes or other tobacco products. And it's primarily for use by people who are addicted to nicotine. There are other substances and additives that will be added to the commercial tobacco that make it more palatable. It lets you inhale deeper or tastes better. And so key ingredients are things like ammonia. So when you see light cigarettes or cigarettes that are easier or better tasting, a lot of times they'll add more ammonia. And so my next bullet point is regional differences, recognizing importance. So as I noted, not every tribe uses traditional tobacco. And even within tribes who use tobacco, there's differences in tobacco that's used. So that could be different plants that are grown. Sometimes it's actual tobacco plants with nicotine in it, but like smaller amounts of nicotine. And then there are tribes that use traditional tobacco that have no actual tobacco leaves, that have no nicotine in them at all. And so I wanted to highlight that there are regional differences, and for some people, it's using plants that aren't tobacco at all. And so sometimes it's gathering them in the wild or growing them on your own. And I just really want to highlight the importance of language. And so when we're discussing commercial tobacco, it's really important to really highlight that it's commercial tobacco, because tobacco in itself is not inherently harmful. Commercial tobacco is harmful because of the methods that they're developed for and how they're used by people. That's what makes them dangerous. And so that's all that I have for traditional tobacco at the moment. And so up next is Clinton Isham.
Okay. Hello. Can everyone hear me? Can you hear me, Josh?
Yep, I can hear you just fine.
All right. Thank you. I unmuted myself on my keyboard and just seeing worked. Anyways, thank you everybody for being on the webinar today. My name is Clinton Isham. I'm a consultant with the American Nonsmokers Rights Foundation. I've been working with ANR collaboratively over the past several years, actually. And my first kind of job that I used to do before working with ANR was helping educate between the differences between commercial tobacco and sacred traditional tobacco. And within that, helping develop policies for the 11 Wisconsin tribes. So I've been working with ANR for about over a year now, and we were working on some projects that were related to kind of putting out messaging around the benefits of smoke-free casinos. And at that time, around last year, August, not 2020 August, but 2019 August, there was around 5 tribal casinos, or 5 or 8 tribal casinos throughout the whole United States that were 100% smoke-free. And we had a really good working relationship. We still have a really good working relationship with one of those tribal casinos, which is Ho-Chunk Gaming Madison. And they're actually on their 5-year anniversary this year of being 100% smoke-free. So we've had some experience just at least working with these casinos and getting some of the messaging directly from a smoke-free casino and what the financial and health benefits were. When COVID-19 struck earlier this year, we had a lot of conversations at ANR and kind of what is next and what can we do. And I had some conversations with Bronson Frick, who is at American Nonsmokers Rights Foundation, about we understood that tribal casinos were closing because of the virus, and we knew that this would be very detrimental financially to tribes, because a lot of us, I'm tribal from Lac du Flambeau, so a lot of us, we depend on these tribal casinos to sustain us economically. They pay for the healthcare, they pay for the education and different programs in the tribe. So we had a conversation about what can we do to help casinos at this time while they are closed. And the one thing that we understood was that smoke-free casinos, there's a lot of benefits with smoke-free casinos, both with people's health and financially. And so we started gathering that information, and we developed some mini videos, which we produced. They were about 3 to 5 minutes long. And one video was specifically on the health benefits of smoke-free casinos, and the other video was on the financial benefits of smoke-free casinos. And with the help of a bunch of amazing organizations, such as the tobacco coalitions throughout Navajo, the Keep It Sacred Network with Josh, and countless other organizations, we shared these videos on social media as much as possible, exhausted our contacts through email and just tried to get these videos out to tribal leaders, because the message in the videos was that, please reopen or consider reopening your casino smoke-free. And these are the reasons why. These are the health benefits why. These are the financial benefits why. And the materials were very, we tried our best to respect the sovereignty of tribes. We didn't want to say, hey, you need to do this because, it's the right thing, or you need to do this, or you need to do that. It was very respectful. It was just, here are the reasons, and please consider doing this. After a couple of months, or a couple of weeks actually, there were a few casinos going smoke-free, tribal casinos that were going smoke-free. A lot of them started in the West Coast, Washington and California. So it was very subtle, like one or two. And then like all of a sudden there was like this huge domino effect where like tribal casino after casino after casino was going, reopening smoke-free. So it was really like a dream come true. And just because we've done this work for such a long time, and we knew that tribal leaders were already thinking of doing this, right? Like they wanted to reopen their casinos to be as safe as possible for their patrons and employees. And so all we did was, we created just some additional messaging to put out there that kind of helped solidify their ideas that they were already having. And so right now there's over 130 tribal casinos throughout the United States that are 100% smoke-free. Some of those casinos are, they have temporary policies, and some of them have permanent policies. I guess where we're at now is and why we're having this conversation really today on this webinar is we're really just trying to normalize this idea still of that we can have smoke-free tribal casinos, that it is possible, it is normal to go forth with this permanently. And I think we're in that transition period where it's difficult for tribes to have these policies permanent, so they'll have them temporary, and it's difficult for them to speak out openly about these policies right now. So I think we are just trying to be as respectful as possible around all of that. And but our message, especially through ANR, is that that we just want to keep chiming in on the financial benefits, and that people right now, the public, they're looking for the safest environments as possible to go to when they leave their homes. We're still in this pandemic, and so we're just sharing that message, and we're trying to normalize that the idea of casinos everywhere being smoke-free. And I think it's happening. There's a lot of organizations that are having more conversations like this. Earlier this month, the National Indian Gaming Association, they had a webinar titled "The New Normal: Smoking in Casinos." So we had a really good conversation on August 5th, just talking about some of the casinos that have already done this, and there was tribal leaders on that webinar, and also tribal gaming leaders on that webinar. Who we're talking about the benefits of it and the downside, the financial downside of it, and it was a really good conversation. If you guys are interested in that, maybe we could put it on. We could put the link on a website through Josh Hudson. But there's just really good information in there about the new normal, really, and kind of the period, the phase that we're in right now. So again, I think the purpose of this webinar is just to continue pushing out the message that the public really wants the safest environments as possible. When they go out for entertainment, they're going to want you know, clean air, where they're going to spend their time and money. And we have Brian Christopher on this webinar, who's going to talk about, and Brett Carter, who they're going to talk about their experiences in casinos, both tribal and non-tribal, throughout the United States, and the preference of what patrons want. And so I think that is, in a nutshell, is our intent of this. And we really want people on this call to, you know, share the resources we have here, and to reach out to your tribal leaders, and to reach out to different tribal entities and organizations, and really want to try to help share this message that this is something that needs to be normalized. This is something that you know, is possible. It's something that works, and I think if we all work together and really pushing it out there more and more, I really think that, you know, we could have all, you know, 500 plus tribal casinos 100% smoke free. And the last thing I want to say is just really want to commend and give thanks to all the tribal leaders that have already implemented these policies, whether temporary or permanent. I just really want you know, to say thank you. And if people on this webinar, if you are near one of these tribal casinos that are 100% smoke free, you know, shoot them a message on Yelp or Google review or anything, and just, you know, really thank them for that, because it's a difficult decision. They're doing something completely different that goes against their norms, and we just really need to support those casinos right now as much as possible. That's all I have. Thank you.
Thank you, Clinton. Up next, we have Dr. Patricia Henderson, who is Danae.
Good morning, everyone. Yate Bennett. My name is Patricia Henderson, and for those that are listening from Navajo Nation or that are Navajo, so greetings, everybody. I'm calling in from Rapid City, the Great Lands of the Lakota people, and I've been working with a lot of indigenous tribes from Australia and New Zealand. One of the things that I really appreciate about them is just giving land acknowledgement. And you know, I'm sitting here on the base of the Black Hills, the sacred lands of many tribes, including the Lakota people. So I just want to acknowledge that. So we've been doing work in tobacco control, or I have, and many of my partners, for many years. And one of the areas that we've really focused on, both in research as well as advocacy work, is the casinos. Because I'm Navajo, you know, my work, a lot of my advocacy work has been with the Navajo Nation, and we have 4 casinos on Navajo Nation. And over the past, how long has it been now? Probably the last 12 years, we've been advocating for them to go smoke free and working with tribal leadership. And we kind of came to, not a stall, but just like, after you do it for so many years, right? You're just kind of like, oh my goodness, like, I just need a little bit more help to get this thing going. And then ANR just steps forward again with Josh, and not with Josh, with Clinton and Shar, and they just ignited that spark that we needed on Navajo Nation. And over the past 6 months now, we've been working really, really hard, just working with them as well as with our coalition down on Navajo Nation for them to go smoke free. And according to the news, and this is the news from the tribal government, the nation actually is going to open their doors smoke free, so which is really, really awesome. But it's just like Clinton said, it's just really advocating, whether it's just, you know, commenting on their Facebook sites, or sending them a letter, a postcard, anything, just to raise interest. And if you're interested, we can certainly share with you some of the tactics that we did with Navajo Nation. And my colleague there on Navajo, Herschel Clark, has done a really awesome job in getting this going. So, but I'm going to actually talk about COVID and secondhand smoke. So advocacy, I will leave to others that are on this call, because I can certainly go on forever about it. So next slide, please. So COVID, you know, in our native culture, there's many, many names for it across Indian country. Of course, Sabadine, or, you know, COVID-19 as it's called in Navajo Nation. And it's just really impacted our communities like nothing has in our lifetime. And these are just some of the stats that I was able to find over the past 24 hours for the Great Plains. And when I say the Great Plains area, these are cases for each of the states, so not necessarily cases for the tribes, but they're increasing. We know that, you know, and if I were just to scan the state of South Dakota, you know, for months, you know, the cases were low among the northern, among the western West River tribes, but they're beginning to peak. And this is a huge, huge concern for us that work and partner up with these tribes, you know, and they've done everything in their power to limit it by, you know, cutting down access to getting into these communities, to really providing the resources that are needed to address this pandemic. But at the same time, more is needed. We know that, you know, because of many factors that we can kind of just look around, and we know because of these factors, poverty, multi-generational households, you know, access to running water, just everything in that manner just exacerbates the conditions for these communities. Next slide, please. So I live in Rapid City, as I said, and we were just discussing this right before our call. We had our Sturgis rally just a couple of weeks ago, and it's an event that has taken place for over the last 80 years, and it's always an exciting time to be a part of it. You know, for some of you have been a part of it, you understand it's a unique culture, great music. It's really a fun enjoyment for many people, and so it happened again this year, and unfortunately, it happened right in the middle of the pandemic. And so public health officials over here are trying to advocate for, you know, the things that we know will stop the spread of COVID, but yet probably just a handful. I say less than 1% of the bikers were wearing masks. And this is important for us in Indian country because our reservation borders, several reservation borders, these towns, you know, Cheyenne River's just down the road, Rosebud's down the road, Ogallala's down the road, and then we have Rapid City. Rapid City has one of the largest per capita. It has actually the largest American Indian population per capita. So we have a lot of natives that live here. They go back and forth to their communities on the reservations. So when this event was held, there's a lot of us that were not too happy with it because this impacts us tremendously. And it's something that we continue to have to advocate for, especially to our leadership, our governors, our state health elected leaders, all the way up to our tribal leaders, then to the president, of course. And so just continue, I guess I would advocate, just continue to advocate for stronger policies. I know that CDC just downgraded some of the things that they were promoting, and which is really, really unfortunate because this is a pandemic and it impacts us Indians, our tribal communities a lot more. Next slide, please. So when we talk about COVID and smoking, you know, some of the first data that came out was a little bit concerning for me as a public health professional. It was actually a study that came out of France, very small sample size, that basically said that for those that smoke cigarettes, actually their rates of getting COVID and the progression of COVID was less. So if you were a smoker, you were in a good standing with COVID. Well, that was just one study, and since then, multiple studies have shown that there is a strong correlation between the progression of smoking, or the progression of COVID and smoking. And we know this now. If I have not seen any data that's come out of Indian country yet, but I'm hoping that there will be some, because there's certainly something going on that is very unique with our tribes, our tribal communities when it comes to COVID. With saying that though, there's a lot more work that's being done just to better understand why this is happening. We know that when somebody smokes, for example, there's a lot of interaction going between from your mouth to your fingers, right? So there's a lot of contact, and the progression of or transmission of the virus is probably more frequent in that way. We don't know, but that's what we're hypothesizing. And this is very important, especially if we're dealing with casinos and smoking in the casinos. Next slide, please. So this study actually just came out recently over the last 2 weeks. Some of our colleagues at University of California, San Francisco did this study, and I think up to this point, the young people, the rates of COVID among young people were very low, but as we know now, more and more young children, young adults are getting COVID, and this is a big concern. The data basically shows that if you're the ages between 13 and 24, there's the diagnosis of COVID is 5 times more than among those who ever use e-cigs. 7 times more likely if you're a dual user, meaning if you smoke cigarette and use e-cigarettes. And then almost 7 times more if you are a dual user, meaning you're currently using both cigarettes and e-cigs. So this is very important for us in Indian country, because we know that e-cigs are on the rise among our Native youth. We also know that there's high rates of smoking among our tribes, our tribal members here in the Northern Plains especially. So the combination of the two, as we go into establishing policies for our businesses on tribal nation, including the casinos, is really important. Next slide. So this is a slide from one of my colleagues that out of Rochester, actually kind of helping you understand. I won't really go into the details of the slide, but it just basically shows like what's happening inside the lung. So as a smoker, you know, we know that when you breathe in the smoke, and then it goes into the lungs, it just doesn't stop, right? It just doesn't stop at the lungs. It penetrates every cell of your body, all the way down from your head to your toes. Smoke gets everywhere. But this is just a cross-section of the lung, what is happening inside the lung for a non-smoker and a smoker when it comes to COVID. So when you, at the top of the slide, you'll see the ciliaries. These are they're like little fingers that kind of are in the upper part of the lungs that basically help trap impurities that are going into the lungs. So if you're a smoker, that area, that part of your lungs gets impaired, and if you do get COVID, what happens now as a smoker is that the COVID or the virus, the SARS virus, actually penetrates deeper into the lung. And this is what that slide is showing, is like there's an impairment that has happened if you are a smoker, because your lung is already damaged. And probably, you know what, I'm going to say this, even if you're exposed to high rates of secondhand smoke exposure, this is probably happening as well. So the virus actually penetrates more, this is they're hypothesizing this because we don't really know it yet. So this is just kind of just a better understanding for us to know like what is happening inside our bodies and why we get sick more if we are a smoker and if we're exposed to COVID. Next slide, please. So what does this mean for us? You know, why is this important as we are talking about COVID, as we're talking about smoking, and for our casinos? Basically, I guess the primary message that I want to share with you is that if we continue to allow smoking in our casinos, there's just going to be a lot more illnesses. I know that the casinos right now are setting up really important protocols to stop COVID. But for example, they're having folks wear masks, and they're doing a lot more checkpoints, which is really awesome. But if we introduce secondhand smoke exposure, and along with COVID, our damaged lungs, it's just going to really impact us. Because right now we don't know. I mean, we're just 6 months into the pandemic, and for those that have had COVID, we don't know exactly what has happened to their lungs. Even if they were asymptomatic, for example, we don't know just the extent of the damage that has happened to the lungs. So we just have to be very, very, I guess, considerate of those individuals as we reopen our casinos. Next slide. So just again, most of you know just what CDC has been, I guess their message about secondhand smoke exposure has been since 2006, when the Surgeon General of the United States said no exposure is the best way. And we know that there's not one ventilation system in the world that can clear out the toxins that are found in secondhand smoke. We did a study recently among Northern Plains children and found that they have high concentrations of cocaine, meaning that they are heavily exposed to secondhand smoke. In addition, we found that many of these children, actually all of these kids that were a part of our study, have high rates of high levels of NNAL. NNAL is a cancer biomarker that is found in cigarettes. And this is, of course, big concern, because it basically shows that the kids here in the Northern Plains, they're under 8 years old, are exposed to secondhand smoke. So I know that we're talking about casinos, but I really stress, it really starts in the home. So really advocate for smoke-free homes, smoke-free cars, because if we start at that level, then it can go into the other businesses like the casinos. Next slide, please. So this is my last slide. And I just, as we're talking about smoke-free policies for our casinos, we also need to consider cessation. It's very, very important. They go hand in hand. And I really would advocate for us to really think about what kind of smoking cessation programs we're going to have for our Native communities. We know that drug use throughout the United States, which includes smoking, alcohol, and marijuana, have increased. And then the addiction services that are provided have decreased. In addition to this, many of our tribal communities are facing trauma due to COVID, trauma due to suicide, completions. So in thinking about this, how do we help our Native populations? And that's a question that we're asking with our organization, is to develop a smoking cessation that really addresses trauma. And I always tell folks this, there's a reason why people start smoking. I know that it's a norm, sometimes it's a social norm, but other times it's due to trauma, whether you've been exposed to trauma that leads to smoking, or even increasing your cigarette daily intake. they go hand in hand. So as a scientist, this is something that I'm really beginning to better understand on my end and how to help our tribal communities. So if you want more information, please contact me. I really, really appreciate being invited on this important call. And like I said, I'm more of an advocate. I love talking about smoke-free policies. And I just want to say thank you to Great Plains for the invitation, and of course to Josh, the network, and ANR. So thank you very much.
Thank you so much, Dr. Nez Henderson. So up next we have Mr. Brandon Mauai, who is a Standing Rock Tribal Council member, to discuss the decision making to go smoke-free during the pandemic. So Mr. Mauai, if you're, oh, I think I hear you. Oh, and I see you. Thank you.
Okay, yeah. Thank you for having me on. You know, just to talk a little bit about what's going on here on Standing Rock, and especially with the COVID-19 and the casinos going smoke-free. You know, I've heard the discussion that casinos are the main revenue for a lot of the tribes, and it is for, especially here on Standing Rock. You know, deciding to go smoke-free wasn't the easiest thing to do. Well, it was and it wasn't, and I'll kind of explain that a little bit more. But to talk about COVID-19 first, is it hit Standing Rock pretty hard, but not as hard as it could have. And I think that the administration here under Chairman Faith and the Judicial Committee taking action and trying to safeguard the people has mitigated the mass infections, I guess, within Standing Rock. We have, when it hit, we began to take action in March by shutting down tribal buildings, implementing new codes, which, you know, was curfews, which limited the number of people that can gather. I know we wanted to be sure that anything outside of the council here, you know, with the exception of government meetings, there weren't to be no types of larger gatherings. So powwows were immediately put on hold for the summer. A lot of the summer, spring sports were put on hold. And then ultimately shutting down the casinos, the tribal administration building. And it wasn't an easy thing to do. It was something that we were worried on how it would affect us financially. How could we move forward and continue to keep in mind that you know, we needed some type of revenue source for the service programs, especially with a lot of the people here going out of jobs and basically everything being put on hold. We, even to today, the tribal administration building, the tribal programs are closed, with the exception of essential workers. So, you know, a lot of the social service programs still continue to provide that for the people here on Standing Rock. But, you know, we encourage calling ahead, utilizing more technology if they have access to that. And if need be, you know, we can send people out into the community with PPE and retrieve, whether it's paperwork, get food out there to the people. You know, it's not an easy thing, especially with the size of Standing Rock. So it was not an easy thing. In terms of our casinos, you know, we are the workforce that we provide between Prairie Knights Casino, and then of course we have Grand River Casino on the South Dakota side of Standing Rock. For those to be put on hold, you know, not only was it scarce for the revenue that could would potentially be impacted, but the jobs. You know, how do we? And you know, in March we didn't even know, and a lot of us didn't know that whether or not the PPP, the payroll protection, was even an option. And so when we ultimately decided to close the casino doors, it was with anticipation that we had enough in a reserve to continue to basically allow our employees to be compensated and not have to furlough or release anybody. Luckily, we have great managers at both Prairie Nights Casino here in North Dakota side and Grand River, that they and their CFOs were able to crunch numbers, figure out that, okay, we can maybe pull through. Initially, first it was 2 weeks, and then 2 weeks had passed. 4 weeks, we can make this work, and then ultimately 5 or 6 weeks. And at that point, we were able to secure the PPP. We were able to continue compensating our employees at both casinos, and it was extremely difficult. When we decided to open the doors again in May of this year, it was slow. It was slow, but we brought the staff back in. We had everybody. It didn't matter if you were a car dealer, if you worked on the floor, if you were a bartender, housekeeping, if you worked in the office. For the 2 weeks when we had brought everybody back, everybody was sanitizing. Everybody was sanitizing every inch of the casinos. They were cleaning out. A lot of food had to be discarded, or we had to get rid of a lot of the food. But more food had to be ordered. That takes about 5 to 7 days to get that in, and so it was a lot of prep. It was like opening back up again. And during those 2 weeks, we had sat down with the general managers. When I say we, so the tribal council ultimately has a say over the casinos, since they're entities of the tribe. But within the tribal council, we have the executive committee, which is 2 councilmen, myself, and Councilman Walker, who is from Bear Soldier, and then the chairman. And between the 3 of us, we form the executive committee. So when we can't get tribal council together, we'll make decisions that are necessary for the casinos. And so when we sat down with the general managers, one of the things came up was, well, it was, if this is something that council wants to do in moving to be smoke free, there's no better time to do it than now. We're cleaning out the duct work. We have everything's being shampooed down. Now's the time, and ultimately we agreed unanimously with an executive committee that let's do it. Let's pull the trigger and go with it. When in 2016, the casinos had begun to struggle during the no DAPL. Our revenues had dropped 40–50%, and we began between 2017 to 2020. Slowly, we began to we were back on an upswing, and when this pandemic hit, we began to decline again. And so, that we took that into consideration was it can't. It feels like we're at the rock bottom now. We can climb out of this, and surprisingly, it's been really positive, with mandatory mask wearing, with constant sanitizing, with the doctor before we had talked about the effects of COVID and smoking. All of these things, it turned out to be a positive thing for us. We have, there's mixed feelings between our customers and the people who come drive down from Bismarck or from Mobridge, but it is something that we wanted to be sure that the staff were safe, first and foremost, and then of course the patrons for the casinos. Today there was a little spike within the last few weeks with cases here on Standing Rock. And so we did implement again curfew for the casinos. So the casinos do close, you know, from midnight to 6 or midnight to 8. And it's been minimal, the impact, but I can say that the revenue is something that we continue to struggle with today. We can't look into a crystal ball and see how this is going to play out for the next year or how long this is going to take. Our revenue has taken a hit, you know, from January compared to this month. I think we are down to only 2% of what we were bringing in for that would fund travel programs. And so, you know, looking forward and trying to crunch numbers, figure out how do we get out of this, hoping that remaining positive and that's all we can do is continue to move forward. And, you know, it's in the safety of our citizens here on Standing Rock and the patrons and the employees. So I guess that's all I have right now. I thank you for allowing me to speak. I believe that my email was provided on there. If there are any questions or anything else, I can send that out. Maybe that can be sent out, or I'll have the secretary send that out.
Thank you, Councilmember Mauai. What we can do is we could create a page with everybody's email, all of the different speakers' emails. So this webinar is being recorded currently, and it will be archived to our website within the next 24 hours. And so we can be sure to place a resource page with all of the contact information for all of the speakers, so that people could contact you if they have questions. But I would like to thank you so much for giving a deeper perspective of what leadership across Indian country has had to grapple with. Thank you so much. And so up next is the North Dakota Smoke-Free Casino Project, and that's it will be presented by Stephanie J., who is Turtle Mountain, Chippewa. And so Stephanie, I'm going to give you keyboard and mouse control, and you'll be able to click through on your own.
Okay. Can you hear me, Josh?
I can hear you.
Okay, I'm trying to figure out how to use the keyboard.
I see that you're moving the mouse. So you can just click the mouse, or you can press the arrows on your keyboard to move through your slides.
Okay. Well, I'm clicking on it and it won't move.
Well, I can.
Okay, did you click that or did I?
Maybe try using your arrows.
Okay, let me try again. Yep, thank you.
Yep, perfect.
Okay, good morning, everyone. My name is Stephanie J. I am a health educator for the Turtle Mountain Band of Chippewa, and I am also the North Dakota Smoke-Free Casino Project Coordinator. This is our tribal logo, and I provided a map for everyone to see where I'm located in North Dakota, very close to the Canadian border. The North Dakota Smoke-Free Casino is a partnership. Today I want to share that with you, what work is being done in North Dakota on smoke-free casinos. This project is a tribal state partnership. My partner is probably on the webinar today. It is Ms. Kara Hickel. She is from the North Dakota Department of Health. She is a health communications and equity specialist. And together we advocate for tribal casinos in North Dakota to go smoke-free. The project started in 2014, and our process, and this project is also funded by the North Dakota Department of Health. And our project includes 3 phases: air quality testing, surveys to include casino employees, community at large, and VIP of the casino, and the final phase is reports of findings. The air quality testing that we did in each of the casinos in North Dakota, I'll show you a list of those shortly. We used a TSI side pack personal aerosol monitor, and that little machine that you see on the slide there is used to draw air through the device, and it measures the particulate matter in the air. The surveys that we do, I have completed one this phase, I should say, with the Turtle Mountain Band of Chippewa. Others are pending. And reports have been given to, on the air quality test results, to various groups such as tribal councils, gaming commission, general managers, health committees, and coalitions. And as a tribal member living on a reservation, I do understand that the politics that may be involved with going smoke-free. As Mr. Mauai had mentioned, casinos are the economic hub in tribal communities. You know, so one of the things during my tenure as the Smoke-Free Casino Project coordinator is I would share health data with my tribal council, let them know, inform them of the lack of funding through the Indian Health Service, the high health disparities in our tribal communities, and personal stories from security guards, from casino employees while we were out in the field doing the testing. The tribal nations and casinos involved in our project include the Turtle Mountain Band of Chippewa, which own the Skydancer Hotel and Casino in Belfort, North Dakota, and the Grand Treasure Casino located in Trenton, North Dakota. The Spirit Lake Hotel and Casino is owned and operated by the Spirit Lake Tribe. The Standing Rock Tribe, as Mr. Mauai had previously mentioned, they own and operate the Prairie Knights Hotel and Casino and the Grand River Hotel and Casino. And the Four Bears Hotel and Casino, owned and operated by the MHA Nation in Newtown, North Dakota. And two other ones that we also did air quality testing for was Dakota Magic Hotel and Casino and the Dakota Connection Casino. And these are owned and operated by the Sisseton Wahpeton. Each of these hotels and casinos were tested a minimum of on two separate dates. Some were tested more by request. That could have been up to 4 times being tested since 2014. And tests were conducted at various venues throughout the building that were decided upon by either tribal government or by casino management. Although these casinos are not 100% smoke-free, they have taken a large step in moving in the right direction. The Spirit Lake Casino, we had conducted 2 air quality tests. Presentation was given, I believe, in November or December of 2016 to the Tribal Council, the Gaming Commission, and Legal Counsel at the Spirit Lake Casino. And in February of 2017, they implemented a smoke-free policy for their gaming floor. They do provide a smoke room that is adjacent to the gaming floor. And recently, the Prairie Knights Casino, Kara Hickel and I have conducted 3 air quality tests in this casino, in the Prairie Knights Casino. And I wanted to mention that I had been invited down to the Standing Rock Nation to meet with the Youth Coalition, and they were very active in promoting smoke-free casino as well. The most recent air quality test results were presented to Tribal Council just this past February 2020, right prior to all the casinos being shut down in March. And as Mr. Mauai had indicated, the gaming floor has been, it has reopened. The Prairie Knights Casino smoke-free as of May 2020, as well as the Grand River Casino with the gaming floor going smoke-free. I wanted to note that on the previous slide, I had mentioned Four Bears. We have done testing at the Four Bears Casino, although that casino for the MHA Nation has had a smoke-free gaming floor since 2012. And as of now, we do have more work to do. I do believe that tribal leaders want to provide safe work environments for both employees and patrons. Right now, our casino, the Turtle Mountain Band of Chippewa, the Skydancer Hotel and Casino is still presently closed. The doors closed for that due to COVID in March, mid-March, I believe, 2020. And the Grand Treasure Casino in Trenton is also closed. And I believe that one closed in early April. The Dakota Magic Hotel and Casino, I had made a call over there a few days ago, and they are reopened. However, they did not reopen smoke-free. And the Dakota Connection is also open, and it is not smoke-free. And with the COVID-19 and all of the research that is being presented Patricia just presented some really good research on the correlation between smokers and COVID-19. Now is the time to reopen smoke-free, and the new normal is to be smoke-free. It should be smoke-free. In our tribal communities, we see a lot of health disparities, and we remind our tribal leaders that the rate of smoking right now in North Dakota is 51% for American Indians. So to implement smoke-free policies can drive that number down, as well as promote great work environments, safe work environments. And moving forward, it's important to engage your community, and you can do this through various ways. Surveys, you can do it with social media and with coalitions. I've used social media to shout out the casinos that have reopened smoke-free and shared the research data behind that. I have asked my community members, put on Facebook is the one that I use the most, put on a Facebook post about going smoke-free. Just kind of put out a little snippet or put out an article, and I do not engage myself in the conversations, but your community members will start talking about. Some will support it, some will not support it, but from the ones that I did share on social media, by the end of the thread, the community members are trying to figure out how to reopen the casino smoke-free or to implement a smoke-free policy. And another area that is very important for policy work is creating a strong coalition in your tribal communities, to identify those worker bees in the community, to choose a diverse group that will assist in producing the change that we want to see. Some of the Turtle Mountain Coalition members include IHS, Public Health Nursing, the Tribal Health Education Department, Car Seat Safety, CHRs. Of course, we need tribal leadership on there, and casino management, school counselors or social workers, substance abuse staff, and to sit down and make a strategic plan over what it is that you want to change. What's the change that you would like to see in your community, and make your coalition visible. When you go to do presentations and present reports to tribal council, to bring them along with you and to make some noise. And that's my presentation. I'd like to thank the ANR and National Native Reef and the Great Plains for inviting me to present today.
Thank you so much, Stephanie. And I know that you have another meeting to get to, so you won't be available later. So here's Stephanie's contact information. And if you have questions for Stephanie, please feel free to reach out to her and email her, because she will be unable to answer any questions that you have later today at the end of our presentation.
Yes, I'm a chair of another work group, so I have to log off. Thank you.
Thank you so much, Stephanie. And so one of our last speakers is Brian Christopher and Britt Carter of BC Slots, talking about smoke-free casinos and social media.
Hey everyone, I'm Brian Christopher.
And I'm Britt Carter.
I'm the host of a YouTube channel called Brian Christopher Slots. And what we do is we travel around to casinos all over the US predominantly and play slot machines. That's what we do. And what we do is we upload a video every single day of the week on our channel, mainly as social influencers for casinos and slot manufacturers. And we've also found our way into promoting smoke-free casinos as well along the way. Basically, that started, I met Bronson with the foundation, I guess it was 3 years ago. And we had been longing to work together and have started to do that the last few years now. And it's been a really great relationship. And now more than ever, obviously, it's the best time to do that. So I wanted to share a little bit of information about the channel, about our analytics, so you guys know what we are, what kind of audience we have. Currently, we get around 5 million views every single month, and we have 175 million views overall, and we've been online for 4 years. We have 1.4 billion impressions, and we get about 150 to 200,000 views every single day on the channel, and we have 280,000 people who have actively subscribed to the channel. On top of that, we're on other social media platforms. We have 80,000 on Facebook, another 20,000 on Instagram, and 25,000 that go to our newsletter as well. We run bcslots.com as well, which is our website, and on there we have blogs and other things where we do talk about our trips, including smoke-free initiatives. And then the breakdown of our audience, we have 32% of our audience is in the 18 to 34 range. 76% of the audience is in the USA. We're fairly even amongst the other ages categories in there, and we skew about 58% male, so pretty close to being split down the middle. Did you want to speak about some other stories and stuff that we have on the personal side for us?
Yeah, so traveling throughout casinos around the country, we are in them all day long. That's our workplace. And so being around a smoking environment is very difficult for us. I noticed, especially at the beginning of the pandemic and the quarantines, that this constant perpetual cough that I had was basically gone after being home and out of that smoke environment for a couple months there. And it made a huge difference as we started going back and being able to visit more casinos that have been smoke-free. It impacts everything about our day-to-day when it comes to how we feel and our health and our energy, and just being able to be the best we can be throughout the day. So it's been great to see the casinos that have made that change, and it really impacts us quite a bit.
Yeah, and I'd say that we can all pretty well agree on the fact that whenever you get home from a smoky casino, the first thing you have to do is rip off those clothes and jump in the shower, because it's like it's embedded in you, everywhere in you. You can't go to bed without having a shower afterwards. And also, I think if you asked most of the smokers that do go to the casinos, do you smoke from home? I would guess that most of them don't smoke in their own home, you know, and so the fact that they're allowed to do that in someone else's home, where the majority of people there are not smokers, and we'll get to that soon, because I think misconception is majority of gamblers are smokers. You know, it doesn't seem right. So yeah, and I agree with the whole coughing thing. I had a sore throat. I've had a sore throat on and off through the past few years, and we're in the casino maybe like 2 or 3 days a week on average. Sometimes less, sometimes more, and I can imagine how it must be for the workers who are the dealers at the tables, where smoke is literally being blown in their face nonstop every single day, full time. So it definitely affects us negatively, and even during my live streams on camera, you know, I'll sit down at a machine. I'm like, oh, let's put another machine. It's like, I can't sit there. It's just the smoke is just too strong that we do need to move on. And as I said, we did meet with Bronson with Smoke-Free Casinos, and we have done a bunch of initiatives with them, and Brett's going to tell you about a few of those.
Yeah, so we do work with the American Nonsmokers Rights Foundation to visit smoke-free casinos around the country. Recently, we visited Soboba, Angel of the Winds, some of the Cherokee casinos, including the Hard Rock in Tulsa, and we're actually currently at the Agua Caliente casinos in Palm Springs, which have gone smoke-free since reopening. We have been collecting some video testimonials from our audience members, and also from the marketing manager of the Angel of the Winds, was someone we spoke with recently. She was so happy with everything that has happened since they went smoke-free. They were one of the very first ones to announce that they were changing that. What she told us in her interview is that people are spending more time here, and we're looking at total growth of carded players that's gone up. We've seen a lot of new players come in and sign up for the Players Club, and we think a lot of that's due to going smoke-free. She also mentioned all of our high touch points were cleaned frequently, but going smoke-free has only made it easier with the ash to keep the chairs cleaner, the floors cleaner, the restaurants cleaner. We've recently gone through an expansion, and having no smoke helps keep everything new longer, and everyone loves that. So it was a big impact for them as they're expanding to be able to continue being smoke-free and make sure that they can keep their casino beautiful. We're also partnering with ANR on sponsoring our Rudy's Weekend event coming up. This is going to give a lot of additional exposure to our most diehard fans that are helping to share our messages. They're regular gamblers, and they're telling their local casinos that they want to play at smoke-free locations. It's been really important to our audience, and we've surveyed them recently. We did 2 phases. First, with our fan club directly. Those are paying members of the Rudies who are part of our membership program every month. And then we did a second phase of the survey with our wider audience. And in that survey, people generally assume that half or more of gamblers are smokers, but we actually found that only 19.4% of our Rudies are smokers and 20.4% of our general audience. So it's a much smaller number than I think most people assume. And we also took a look at our high income gamblers, and of our audience members who are at $100,000 income or higher, that dropped to 16.9% being smokers. So it's definitely a much smaller number than I think a lot of people assume. We did find that our audience has an average budget per trip to the casino of $1,122, and that about 68% of our people visited a casino multiple times per month. And among those people, 96% of them would visit a casino that only had outdoor smoking, including 89% of all the smokers. So of the smokers, even 9 out of 10 of them really would prefer to be in a smoke-free casino as long as there's an outdoor smoking location for them. Some of the quotes from that survey that I'd love to share with you is that one person said, "We only have one casino in my area which is smoking, so instead of going there, we save up and take a trip to a non-smoking casino." One person said they drive past 6 casinos to go to a smoke-free one. And several mentioned that it affects the amount of time they spend in a casino. One said, "I don't mind it, but my wife hates it. She would go with me if it was non-smoking, increasing my time and visits to the casino." And then one of the biggest points that we have really noticed and people mentioned was that someone said, "I will also only go to casinos that require masks, and yet masks are removed to smoke. It just doesn't make any sense." And that's one of the biggest things for us during the virus and the pandemic we've got going on is we know that masks are important and that they're one of the most effective ways to prevent the spread of COVID. And if you take it off to smoke, it kind of defeats the purpose of a mask. And so we are so proud and happy to partner with casinos that are smoke-free and are really putting everyone's health first going forward.
Yeah, really great points in there. And literally, I have a list of another 40 quotes from fans just from the last week and a half on YouTube. I haven't even looked at the ones on Facebook to include in there. Like, people are very happy about this movement, and it's definitely something they want. And a lot of the positive comments are coming from smokers themselves. A lot of them said, even I don't like going home smelling like an ashtray. And they wouldn't. I mean, who really wants to? I mean, I used to be a smoker back in the day as well. I didn't like smelling like it. I don't want to smell it on my fingers or my clothes or anything else on top of that. So I think it's a positive for smokers and non-smokers to make the casino floor entirely smoke-free. There's no good enough ventilating system in a casino that will get rid of all the toxins in the air and make it clean for everyone. So
we are continuing to partner with the American Non-Smokers Rights Foundation and smokefreecasinos.org to visit casinos throughout the country. We want to come to you. We want to help make this successful for you by promoting your locations to our audience and really celebrating the fact that you've made this great decision to be smoke-free and be safe and healthy for everybody.
Yeah, and I kind of feel like we're preaching to the choir. You guys, I mean, everybody knows this, right? Everybody knows that smoking is bad for you and you shouldn't do it. But I think the misconception has always been that, gamblers are smokers. They go hand in hand, a cigarette and gambling. And we've proven that from 2,300 respondents that is just not true. And there was just another recent survey that came out from another source, which also stated, I think on theirs it was about 75 or 78% preferred non-smoking casinos. The time is definitely right now. And I'll close with, I get these emails, I get a lot of emails from casinos, obviously, because I have a player's card with hundreds of them, and I get them every day. And throughout the pandemic, the tagline is always, "Your health is important to us. Therefore, we're making masks mandatory and we're putting out hand sanitizer." And the argument is, well, if our health really is important to you, then it always should have been important to you. And such smoking should not be allowed in casinos, because obviously if my health's important to you, there should be no smoking, period, end point, done. So that's what we're pushing for, and it's not an attack on smokers whatsoever. I do have a lot of smoking fans, and I do let them know that it's not. I'm not against you. You know, you're allowed. It's your choice to smoke, and that's why I think it's nice if casinos can provide an outdoor smoking patio for them. Many casinos in Maryland and other areas have outdoor smoking patios with slot machines that they can still play at, but are not occupied by staff. And has outdoor ventilation, natural ventilation out to the fresh air. And of course, we're open to many questions right now. If you guys want to add those into the chat, we will be here for that.
So actually, I have a couple questions directly for you, for the BC Slots folks, and then we'll open it up more widely. But the first question is, are your stats and testimonials available? So I imagine the things that you were just reading, are they available on your website or?
We do have a blog on Brian's website that was posted after the first phase of the survey that we did. And we're working with ANR right now to put together a full one sheet that has a lot of those stats, has some quotes included, and that should be available in the next probably week or so.
Okay. There was another question asking about the survey that you conducted. Was it among people visiting casinos? And then it just notes that it's very important because that data is hard to find.
Of course. So the survey was primarily, the first round was sent out to our fan club members. That means these are people who not only are gamblers and not only enjoy going to casinos, but they love its slots so much that they pay a monthly fee to us to be part of Brian's fan club. So they're very engaged and very active members. Like I said, all of them go to casinos regularly, and almost 70% of them do visit casinos multiple times per month. And then the wider audience that we surveyed, again, is people who do spend time watching slots online for a variety of reasons, but generally it's because they love gambling. Yeah. And so this is a gambling audience that this was directed at.
Yeah, and so to make sure that our numbers were not skewed, because there was the worry that, oh, but they're your fans, they're going to want to give you what you want to hear. That's why we separated it out and kept those numbers separate from our fan club. And everyone else who responded came from two different areas. Number one, from our live streams that we did in our videos. I told everyone to go fill out our survey. And then the other one was also in articles. We were listed in like a few CDC articles and places on Twitter where we told people to come join the survey, fill it out for us. And so we don't know, like a lot of those people were just from the magazine or from the email blast as well.
Thank you. And then this is just a question that I'm interjecting. So for the people listening, what are some ways that we could become accomplices in helping spur smoke-free casinos, or to at least applaud? I know that it was mentioned before, it was Clinton that mentioned, just liking or sharing or Yelping, Yelp reviews. But is there anything that, especially because social media is the realm that you operate in, what roles could all of us play to just help support this decision-making and, moving in a healthy direction for everybody?
Yeah, I think what Clinton made a point earlier about, reaching out to the casinos who have made this choice and thanking them for what they've done. I think it's really important. When we go to casinos, we fill out comment cards as well and let them know, I had a great stay. I wish it was smoke-free. We would have played longer or something like that. Or congratulations on going smoke-free. We're very happy for this. And for our fans to write it on their social media platforms as well. We constantly will be sharing other casinos' posts and thanking them for going smoke-free. And also there's a ton of articles right now about how numbers are doing in casinos, how they're doing compared to last year's numbers, right? And surprisingly, a lot of casinos are actually pulling out higher numbers than the previous year. And now they're only letting in a lesser amount of people and gone smoke-free. And I think it's been a big wake-up call to a lot of casinos who have maybe temporarily gone smoke-free to see like, oh, people are actually still coming to the casino. All my staff are actually a lot happier. The patrons are happier. And literally, if you go to I've been to many smoke-free ones. If you go to their smoking patios, there's not a lot of people out there smoking. And it shows you that I think there's a lot more non-smokers than they realize. And I think just reaching out to them on social, especially, is a great way to do it. And having us come to their casinos and also promoting the fact that that casino has gone smoke-free will let our audience know oh, we can go to that casino instead. And we've had that happen a few times in our live stream. Someone's come up to me during a live stream, been like, hey, Brian, I was just out at such and such casino. I heard you were at this one. We just drove over here instead. Oh my gosh, it's smoke free here. It's amazing. And we love this casino now. And now we're going to start coming here. Like we've got that many times, believe it or not.
I think you saw from Angel of the Winds, they mentioned that their new card signups are up. It's increasing, and they're bringing in a younger demographic. And I think that's because there are a lot of people who would go out and gamble if they could be in a smoke-free environment, who would spend more time at a casino and be more loyal to a casino if they were more comfortable and not have that smoking. And one of the other big things I thought was really important and telling to me was that San Manuel, one of our casinos here that we visit fairly regularly, when they initially reopened, they did not change any of their policies regarding smoking. And about 2 weeks after, they went completely smoke-free. And I think that, you know, we all know that masks are important, so I don't think that was new information. I think they really got a lot of feedback from their guests that they wanted a safer environment and they wanted that smoke-free environment. And so they made that decision to change over to smoke-free. And I think that it's been very successful for everybody that we've visited who has made that change.
All right, thank you, Brian and Britt. I did have a question that I wanted to toss it over to Clinton. He wanted to ask something of Councilmember Mauai.
Hi. Well, first, thank you, Britt and Brian. I think I could speak for every single Native auntie and grandma that you guys have the most awesome job in the world. I love watching your videos, and I know my mom loves watching your guys' videos too. The question I had for the tribal leader from Standing Rock was that I think we're always looking for ways to support tribal casinos and tribes in general, especially now. And sometimes we don't have a lot of communication with tribes directly on how or like the best ways to support tribes. And sometimes we do, but my question is, what is your advice or suggestion to organizations, public health organizations and advocacy organizations like ANR? You know, what are the best ways that we could support the tribal casino and tribes right now during this time?
Mr. Mauai, if you are speaking, you're probably muted. We're not able to hear you at the moment. Oh, it looks like he might have gotten disconnected.
Yeah, I'm sorry, Josh. I think he had to also jump off a little early.
Okay, that makes sense. Okay, so Brian and Britt, will toss it back to you for some more questions.
Okay, great. Happy to hear any questions that people might have.
So there is a question: have you visited or will you plan to visit any casinos in New Mexico or Arizona?
We would love to. Brian actually just visited Arizona casinos for the very first time back in May. And we do have a great audience in that area that we'd love to really expand and do more. Because it was so early after the quarantines and everything, we weren't able to host any events or really encourage our audience to come out and join us at that casino. So as you know, we're able to do more of that. We would love to get back into that area, but we need permission to film. You know, most casinos don't allow filming typically, and so we need to work with the casino. So please reach out to us. We'd love to.
We have a ton of requests from fans about New Mexico. I don't have any contacts there yet, so if you know anyone, let us know, because our fans are dying for us to get over it for sure.
Well, the person who asked the question, I imagine he has some good contacts. So we'll be sure to include your email, you know, Britt and Brian, in the one pager that's going to have the contact information. So
yeah, we also have there's a contact page on bcslots.com as well.
Yes.
I'm typing out a response really quickly. You said bcslots.com?
Yes.
Yeah, that's right. It's on my shirt if you can see it.
Yeah.
So another question, and I don't think this is specifically just for Britt and Brian, but it's asking if the smoke-free initiatives, if they include vaping in the policies. And I think that generally it depends on each, because each policy will determine on whether or not e-cigarettes or vaping is included. But if you had anything that you wanted to add, Brian or Britt.
We've been to 21 casinos since they've reopened so far, and all the ones that were non-smoking included vaping as well.
I think part of that is taking off the mask. That's a big reason why we're going non-smoking right now, is keeping masks on. And so that would include vaping and e-cigarettes.
All right. So there was another question too about the survey that you did. Did you ask demographic questions of people who were responding to your surveys?
We do have some information as far as like gender and household income, and a little bit about that. But if there's no specific questions they have, they can certainly reach out to us. We can get that info if we have it.
Okay. And then another question for Brian and Britt. Do you guys look on the NIGA website, the National Indian Gaming Association website?
I have.
Just in general? Yeah, we were planning on attending NIGA this year before things changed. So it's definitely something that we're keeping an eye on for sure.
Okay. So I think that this is a broader question. This is more of like a public health question. So it's just asking, thank you to all the speakers. Do you have any advice for state health departments on how to work, on how to support your work? So I'm opening it up to all of our presenters. And if you're speaking at this moment, we can't hear you.
Can you repeat the question, Josh?
So it was just thanking for all the speakers and then asking if there's any advice for state health departments on how to support this work.
Josh, this is Patricia. What we've done in this with Navajo Nation is we have a little bit of funding coming from the state of Arizona to support our efforts. And they've been very, very supportive in what we're doing, particularly just going online and creating actually a Facebook page to really advocate for smoke-free casinos. So in that way, they've been really good. I guess what I would do for tribes here in the Northern Plains is just reaching out to them with everything that's happened during the pandemic. I'm sure they have a little bit of funding available for them to chip in to your efforts. And then also ANR. ANR is a great resource. I'm not sure if Char's still on the line, and of course Clinton, but there's funding available through ANR if you're wanting to create a smoke-free policy for your communities, which includes casinos. So I guess those are the two resources that I can think of right now.
This is Clinton. Isham. I've worked a lot with the state of Wisconsin in my other job that I've had, and led a native tobacco prevention state coalition as well. But I think from my experience, the one thing I would suggest for states is to try to be as flexible as possible with funding tribal entities or tribes or tribal coalitions in your state. And I know the funding that you guys get, there are a lot of like rules and restrictions to it, but I think the way that tribes operate is very unique, and especially with the types of tobacco policies that a specific tribe would want to engage in with the community. So my my biggest suggestion is that just try to be as flexible and as possible and open-minded as possible, and to learn as much as possible when working with tribes, yeah, just be open-minded about it. And if the funds that you have are they can be used for whatever purposes, and they are not flexible, then look for other types of funding that you can offer that are less restrictive. I think that's one of the biggest things that I would suggest.
This is Josh. I wanted to chime in. So this is kind of the work that the NNN does, but I really wanted to make sure that I'm centering other people's voices. But the network, we provide training and technical assistance. We receive funding from the CDC specifically to complete this work. So asking for advice on how state health departments can help support the work. Generally it's about building a relationship and rapport with tribal communities, tribal agencies, and urban Indian communities and agencies. It's very important to take note of how many tribes you have in your state, both federally recognized and state recognized. And then also if and where your urban Indian communities are, and you may have multiple urban Indian communities that have been established, and sometimes it's informal and sometimes it's very formal. There could be established nonprofits, or sometimes it's just a meeting group of people. It really just depends on where you are in the questions that you're asking. But in terms of helping support smoke-free casinos work, really establishing and building relationships is really important. To make sure that you can work in a quality way with the tribal community. And I know that it's really easy to get caught up in the work plan and the objectives and the goals, but I think when you approach, especially as a member of a state health department, one of the larger overarching concerns that you should have is, what does this community need, and what supports do they need? Because most communities understand what their problems are, what their ailments are, and how to heal them. It's just that typically resources are lacking. And so, and when we talk about things like, I know Dr. Don Warren, who is, a very well-renowned American Indian physician, so there's a big press on evidence-based practices, and some of this, many states have ties to funding structures and funding opportunities with evidence-based practices, but the problem is that there's not a lot of infrastructure in Indian country to be able to pay for evidence-based practices to be researched and published. And so I really want to highlight that the state of Oregon actually, through their legislature, recognizes American Indian culture as an evidence-based practice. So say you're doing a youth prevention program on smoking prevention, and it's rooted in it's a curriculum rooted in American Indian culture. For all intents and purposes, the state of Oregon views that as evidence-based practice implementation, which is just so cutting edge. That's so cool. So that's another option that, as someone from a state health department, you can really, I know that there's definitely demarcations between people working for the state and people who legislate for the state. But if there are questions from legislators, you can provide information and say, like, well, in Oregon, they did this. Or, it's something that could be brought up during tribal consultations. These are, if we want to improve our relationships, we have to work really hard. And I know that policy work is very, very difficult. But if there is a serious interest in helping tribal communities improve health disparities, a lot of work's going to have to be done, and it's not going to be able to just all be the tribal employees who are doing the work. It's going to have to take everybody jumping on and really helping out. So I really want to highlight the state of Oregon, or trying to find those ways in the in-between too, of what are ways that we can try and help mitigate some of the red tape that's here. Not go around it. I'm not advocating for anyone to do anything illegal, but finding the workarounds for how to get things done appropriately and most efficiently and effectively. Because the thing that I really want to highlight is many of the tribal employees, especially in tribal health programs, are wearing multiple hats, right? So it could be a community health worker who transports and does case management. And, you know, they could also be a court-appointed special advocate or a foster parent in the evening. So like there's people who wear multiple hats, sometimes within their job and sometimes just within their lives. So really approaching it with that same sense of understanding that your project that you want to help them with is not the most, you know, overriding concern that they have. So, you know, finding the ways that you can work with them appropriately and effectively. There is another question asking if anyone uses the American Indian Adult Tobacco Survey or the AIATS. So this is, again, Josh from the network. I haven't used the AIATS because I don't work directly with individuals. I work with programs, so I work at the programmatic level. But the CDC recently revamped the American Indian Adult Tobacco Survey, and that is available on their website. And I know that the agency that I work at, the Intertribal Council of Michigan, has used the AIATS, and we even adapted the AIATS to ask broader health questions, not simply just tobacco questions. And so we frame it as the American Indian Adult Health Survey. And we just implemented some BRFIS, or the Behavioral Risk Factor Surveillance System, question modules, like the modules for things like cancer or, you know, activity. So I think that's about it for the questions. Thank you everybody for dialing in today. I'm so glad that you were able to join. It was really great having everyone here. Thank you to all the speakers. We had quite a few speakers and we got it all done in time. So thank you everybody for attending today. The recording will be available within the next 24 hours on our website, which is www.keepitsacred.org, and we will include links to all of our appropriate organizations and speakers. Thank you, everybody. Have a great day and a great weekend.